heart failure. There are many causes of heart failure. The two most common causes are blockages of blood vessels in the heart and high blood pressure. It is important to work with your doctor to treat these causes, as well as other medical conditions, in order to prevent your heart failure from getting worse over time. Signs and symptoms of heart failure. Early symptoms. These are symptoms to discuss with your doctor at your next appointment. They are not emergencies by themselves, but can cause worsening heart failure if you ignore them. Fluid retention. Eating too much salt or drinking too much fluid can cause swelling in your feet, abdomen, and ankles. Your heart then has to work harder to pump that extra fluid around your body, which leads to more swelling, shortness of breath, and weight gain. Increased swelling. You may see swelling in your feet, ankles, thighs, or abdomen. You may also notice sock marks around your ankles at the end of the day. Your shoes feeling tight. Pitting, where you press on a swollen area and it pits or leaves a small dent that slowly fills back up. Weight gain. You should check your weight daily. Weight gain may be an early sign that your body is holding fluid, even before you feel short of breath or notice any swelling. A person can hold many pounds of extra fluid before other symptoms appear. Remember to weigh yourself as soon as you get home from the hospital. This is your dry weight, which is your body weight without any extra fluid. It should be your goal to stay at this weight. Write your daily weight in the same place that you wrote down your dry weight. Weigh yourself upon awakening every morning, after urinating, and before you have breakfast. Weigh yourself at the same time, on the same scale, and in similar clothing every day. If you got your dry weight wearing clothes but no shoes, weigh yourself each day with clothes and no shoes. Always compare your weight with your dry weight. If you gain 3 or more pounds in a day, or 5 or more pounds in a week, call your nurse or doctor. They may change the dose of your water pill, ask you to come in for an appointment, or ask you to go to the emergency room, depending on your other symptoms. Here's a knowledge check for you. If a person with heart failure gains 2 to 3 pounds in a few days, this usually means he or she has extra water in the body. Other early symptoms include a gradual loss of appetite, shortness of breath or tiredness with physical activity, worsening dry cough, particularly when you lay flat at night, and shortness of breath when bending over to tie your shoes. Urgent symptoms. These are symptoms to discuss with your nurse or doctor quickly and should not wait until your next appointment. Urgent symptoms include if your symptoms worsen or when any lasting early symptoms do not improve within 2 days, urgently report to your doctor or your care team. For example, if you do not lose the weight that you have gained back to your dry weight within 2 days, or if you continue to gain weight, that would be an urgent symptom and should be reported to your care team. How often should a person with heart failure weigh themselves? Every day. Other urgent symptoms include waking up throughout the night with cough or shortness of breath, using more pillows than normal to sleep at night easily, increased shortness of breath with effort or physical activity, rapid heartbeat or palpitations, coughing up pinkish or blood-tinged sputum, fever or flu-like symptoms. Urgent symptoms. Call 911 for help immediately or go to the closest emergency department if you develop any of the following: chest pain that lasts longer than 15 minutes or does not get better with rest or nitroglycerin. Lasting or severe shortness of breath, especially while resting. Feeling lightheaded or dizzy, like you are about to faint. Medications and heart failure. Heart failure medicines can control symptoms and help you live a longer and more active life. Examples include diuretics or water pills to help your kidneys make more urine and pass more water, beta blockers to strengthen your heart, and ACE inhibitors to block the effect of stress hormones and prevent heart failure to get worse. You should never skip taking your heart failure medicines, even if you feel better. Tools for taking medicines. Create a chart with the name of your medicines, their doses, and the time of day to take them. Develop a routine around taking your medicines, such as brushing your teeth, eating meals, or getting ready in the morning. If you forget to take your medicines, make sure to take them as soon as you remember. Remember to take enough medicines with you when traveling and pack them in your carry-on luggage. Let your nurse or doctor know ahead of time if you need refills. People who have heart failure take diuretics or water pills such as Lasix so that their kidneys will make more urine and pass more water. If a person with heart failure forgets to take their medicine, they should take the medicines as soon as remembered. Talk with your doctor or nurse about concerns with your medicines, including side effects, cost, a hard time picking them up from the pharmacy, or with taking your pills. And finally, bring all of your medications, bottles, and pill boxes with you to every appointment. Health behaviors and heart failure. Overview. It is important to watch your diet and lifestyle to prevent your heart failure from getting worse. In addition to taking water pills, limiting the amount of salt and water consumed is important to lessen the symptoms of fluid overload and congestion. Fluid intake. You should limit the amount of fluid you drink, including water, liquids such as juice, milk, ice cream, yogurt, jello, pudding, and soups, to no more than 2 liters every day, or approximately 8 8-ounce glasses. Some people with heart failure are told by their doctor to limit fluids. Which of the following count as fluids? All of the above. Tips for limiting fluid intake. Use small cups and have designated pitchers for fluids so you can keep track of your intake. Divide drinking your fluid throughout the day. Tips for being thirsty. Try chewing sugar-free gum or sucking on hard candy or ice, eating frozen fruit, using glycerin mouth swab sticks, or drinking hot water. Salt intake. Most foods contain natural salt, so you should never add salt to your food. Extra salt leads to fluid buildup, which causes heart failure symptoms to get worse. Avoid processed foods, such as TV dinners, smoked or cured meats such as ham, and table salt, because they are a big source of salt in the diet. Eat good sources of low-salt foods, like fresh fruits and vegetables, unprocessed foods, skim milk, cereal, and fish. Remove the salt shaker from your kitchen and dining room table. Avoid canned foods, processed meats, frozen or TV dinners, and eating out at restaurants as much as possible. Here are a few more knowledge checks. Which food has the most sodium or salt? Baked ham. Which food has the lowest sodium, salt? Baked apple. Which fast food has the least sodium or salt? Baked potato with sour cream and chives. Always check food labels for salt content and look out for high amounts of sodium, which is another word for salt, and avoid any food with more than 300 milligrams of sodium in one serving. Here's another knowledge check. The recommended maximum total daily amount of sodium that persons with heart failure should eat is 2,000 milligrams. How many servings are in the can of soup? 2.5. How much sodium is in one serving of soup? 890 milligrams. Other diet and lifestyle changes. Try to eat smaller meals. Avoid all alcohol, tobacco, and recreational drugs. If you have a headache or any other pain, the best drug to take is acetaminophen, Tylenol. Avoid aspirin and ibuprofen, including Advil or Motrin. Final knowledge check. It is important for a person with heart failure to do all of the above. If your doctor prescribed a CPAP machine or breathing device for sleep apnea, make sure to use it every night. Physical activity and exercise. Physical activity is helpful for people with heart failure, and you should perform light exercise every day. Walking is a good way to start. Then you can increase your pace and intensity slowly. A good rule is to be able to talk while walking. If you have difficulty speaking in full sentences during physical activity, then that activity may be too intense. Stop exercising and rest if you develop shortness of breath, dizziness, or chest pain. If symptoms last after you stop exercising, contact your doctor or care team to go to the emergency room. Communication with family, friends, and the care team. It is very important to follow up with your doctor after you leave the hospital. It is always a good idea to bring a family member or friend with you, especially if they help you manage your heart failure at home, and keep that person's number available for help as an emergency contact. Always have your doctor or nurse's name and phone number available.